Hello, I'm Todd Barnes. I'm the Communications Director for the City of Thornton. I'm coming to tell you some information regarding the status of the City of Thornton during this COVID-19 crisis. One of the important things for you to know is that the city facilities are currently closed to the public. That's all of them, our recreation centers, City Hall, and all of the places you're used to going to, like our Arts Center. Those are all closed currently. We will reevaluate the status of all of these buildings on an ongoing basis and be sure to let you know when any of that changes. With that in mind, communicating with you is our chief goal and making sure that you know what's going on as much in your region and city as possible. With that information, I need to tell you the best ways to stay in touch and receive the messaging that the city is sending to you. We are using Nextdoor and other social media platforms like Facebook, Twitter, Instagram, to try and get the information out to you as well. And always feel free to come to the city's main website. It's like the central library of what is going on in the city of Thornton, and that's www.thorntonco.gov, and you will be able to see all of the updates that we're providing out on social media, and that website will be updated frequently. Reminder that the restaurants were recently closed. That's going to be happening for at least 30 days. They're closed for sit-down service. You can do delivery and takeout, and I'm sure if you take advantage of that, the restaurants will be very appreciative of that. The next thing we wanted to update you on is more of the technical status and issues involved with the COVID-19 virus. And to do that, I'm not qualified. I'm going to bring in Theo Gonzalez. Theo, come on in here real quick. Theo is in contact with the state all the time about some of the operations and some of the information that's coming out on the status of things. Theo, let's start off with just saying, Adams County has not been hit hard as of yet,
right?
And that's good. But we fully intend for this to spread. Is that correct?
Yeah, that's correct. So we're seeing a uptick in the cases daily. Daily, we've been adding about 20 cases to the state numbers every day. Currently, the Adams County numbers are fairly low, but we do expect that to change as the scalability of the testing moves up. If you caught the Vice President's presser, you'll notice that they talked about an increase in testing capacity, and we expect to see that this week. And so with an increase in testing, we're going to have some cases. And so we're fully prepared to deal with those cases. The fire department has many contingency plans. We have a pandemic plan that we have already dropped into or deployed at this point. And so we're looking good. We have plenty of PPE.
Tell people what PPE is.
PPE are protective garments that we wear. We've put out some press releases on social media to show you exactly what we would look like. We're wearing N95 masks, we're wearing goggles, we're wearing a white Tyvek suit, and so that's not to be alarmed. Don't be alarmed when you see us in that. That's just
it's responding with an appropriate level of caution.
Yes.
That's what the fire department is doing. So before we get into a lot of technical stuff, let's give people the important information they need to know about staying home and social distancing.
Yep. And we were just talking off camera about this. It's hard to fathom that to stop a pandemic like this. Really, those are the two most important things in our fight against COVID-19, and that's social distancing and just good hand hygiene. And watching how many times you touch your face and wiping down your work area if you're still at work, or even cleaning your house a little more, a few more times in a day than you would, cleaning your bathroom areas after you use them. So really, the social distancing is the key, though, and I think as you spoke about the steps that the state is taking right now, that the governor announced, is those things. It's social distancing, it's closing restaurants, it's taking away those opportunities for us to gather. And so really, I think we'll see a marked improvement with those things, and I really appreciate that the state has been so aggressive in helping us maintain those social distancing mechanisms.
Yeah. One of the things we've heard about is called flattening the curve. Can you explain that a little bit?
Absolutely. I was just on Facebook yesterday, and I saw that's kind of trending now in all socials. And so really, what that's speaking to is we know that our healthcare system is a continuum of time, and on the timeline, we have only so much capacity to deal with so many patients at one time. And when we speak about the curve is speaking to if we were to get a huge influx of patients with COVID-19 or even some other, we're still running regular 911 calls, people with heart attacks, people with strokes, people that get in car accidents. If we see a huge surge of people at one time, we spike in that curve. And when we spike in that curve, we actually come out of the ability for the healthcare system to care for those people across that continuum. And so that's called surge. And that's one of the things that we've been working really hard this week is planning on surge capacity. And the hospitals are also doing that as well. So when we talk about flattening the curve, what we talk about is we want to delay the onset of the disease. So we don't want everybody to get it all at once. We want to sort of march it out so that the healthcare system can kind of keep up with the number of people that are getting it, if that makes sense.
And social distancing is vital for that.
It's really the number one most important thing that we can do.
Yeah. Tell people briefly about some of the, not in detail, but just the different organizations that are working with the City of Thornton and the state, and how we're interacting to do the emergency preparedness.
Yeah, so there's, when they say, you've heard the term, it takes a village. Really, when you're dealing with a pandemic or even a local epidemic, it really does take a village and more so. So we're working with our FEMA partners, we're working with our state partners, we're working with Tri-County Health, who is our local health agency. They've been really good about giving us guidance for a lot of these things. We're working with suppliers. As you know, there's a huge shortage in those protective garments that we wear. And so we're really working with those people and the supply chains to supply us and keep us safe and have a good supply of not only those things, but medicines for those regular calls that we talked about that we're still running. We still got to do those. So really it takes a village, and we're really working with, it would probably take me 30 minutes to go through the list of people that we're working with, but much like you're dealing with here in the city, we really are reaching out and in concert working with almost everybody that you could think of.
Yeah, and one of the messages we heard yesterday is that there was the big rush on the grocery stores and the Costco's to get all the supplies and stuff like that. I think we need to tell people that needs to calm down, because
absolutely,
the supply chain will catch up. We got that from the governor yesterday, correct?
Absolutely, yeah. And I can tell you that internally we've spoken with the supply chain warehouses, because one of the things that we found that affected us was our firefighters could not go out and shop, and we need to feed those guys too, because we work 48-hour shifts, so we're here for 2 days. So much like people out there need to get their groceries and get their toiletries, our guys need to do the same thing. And what we're finding is they were being really grossly affected by the runs on the grocery stores. And the word that I want to put out there is there is no supply chain problems, just like you mentioned. The warehouses are fully stocked. The problem is getting that product from the warehouses to the distributions like King Soopers, like the Safeways, and they just can't catch up. And so really the message that I would like to say to people is just when you go shopping, there's no problem with the supply chains. Get your normal week's worth of groceries. You don't need to shop for a month. That is the problem right now, is people are stocking up for a month at a time, and when we have those runs on the grocery store, they just can't keep up. Now they're doing some things to sort of limit that, and they're also doing some things to kind of work and catch up on the supply chain or on the redistribution of those things from the warehouse. And that's things like they're going to be closing earlier, they'll have some different hours, and those are specifically to restock the shelves. But there's no problem with the supply chains. There's plenty of food, there's plenty of toilet paper out there. It's just in a warehouse, so please let them get it to the King Soopers and your local Safeway. Right.
Let's talk about emergency medical response. So people find themselves in a little bit different situation now. You have experienced an increase in calls with people concerned about the illness, but the level of service from the fire department and from the police department is not going down. We've taken a lot of precautions. We've done a lot of internal planning to make that happen. Can you tell me what you guys are experiencing?
Yeah, so we are seeing basically an upscaling of people calling for COVID-19 related calls. And one of the things I want to point out is that when most people catch COVID-19, 80% of those people are going to have either no or mild symptoms. So this is going to be no worse than a cold. And I don't say that to downplay the illness. I just say that simply because if you are in that 80%, really you can care for yourself at home, you can recover at home, And really that social distancing piece of not going out, not going to the doctor because you really don't need to, comes into play. But those 80% are the people that are calling us right now, and they're really the ones that are starting to strain the EMS system. And I say strain just because we're seeing an uptick in that, and we're still running our normal calls, our heart attacks, our strokes, and our car accidents. And so what I can tell you is that the other 20% of those people will have moderate to severe symptoms. And those people are the people that we want to focus on. And from that 20%, about 2% of those people will have really acutely severe and need respiratory intervention and ICU type interventions. And so really for those 20%, those are the people that are okay to call 911 and they need to be in a hospital setting to be treated. But the other 80% are more than fine to stay home. And that's actually what we're advocating is if you have mild to almost no symptoms, you can just treat at home. You can call your healthcare provider over the phone. A lot of agencies and Kaiser, a lot of the local clinics are doing televisits now. They'll talk to you over the phone. They have Facebook, Skype. A lot of apps are being used to actually do some innovative stuff as far as reaching out and not in person to reach that social distancing goal.
Sure, sure. Theo, anything else that you can think of that's important for people to know at this point in time? This won't be our last time talking to you, I guarantee you.
Yes, there's always more information. I would just like to remind people that Thornton is very well prepared. I'm very impressed with the steps that Thornton has taken. I think we have been a regional leader in some of those steps that we've taken. So I really commend our senior leadership team, Kevin Woods, our city manager. They're really looking out for the best interest of our people and our employees. That not only our citizens, you're in great hands, but our employees are also in great hands. And the fire department has a plan, and we have a plan B, a plan C, and a plan D. And so if we get to Z, we have that too. And so we're very well prepared, and so you guys are in very good hands.
Thank you, Theo. Really appreciate it.
Yeah, thank you.
Not going to shake hands?
Yes, no.
All right. So an important thing to know is that while the buildings are closed, the levels of service are going on behind the scenes. Our city management has consulted closely with the mayor and city council, gotten a lot of good guidance and got a lot of good recommendations and good flow of information from you out there in the community. We appreciate that. We always want to hear from you, and we plan to do that. Going to end this now by saying please stay safe, please stay home, and please be well, and we will talk to you again soon.